Assalamualaikum. Today I would like to share with all of you our study which is about fall characteristics of Malaysian older person in Klang Valley. This presentation will divide it into four main parts which are introduction, methodology, results and discussion, and the final one is the conclusion. Introduction. The risk of falling increases with age, with 1 in 4 older persons experiencing a fall each year. Falls can result in debilitating medical conditions such as fracture, head injuries, and soft tissue injuries, such as sprain, strain, contusion, and laceration. Environmental factors play a very significant role in contributing to falls among older persons. Factors such as slippery or even uneven surfaces, inadequate handrails, poor lighting, and cluttered living spaces. Thus, understanding the characteristics and the risk factors associated with falls in older persons is very important for developing effective preventive strategies and promoting successful aging. To date, comprehensive studies in Malaysia on fall characteristics are very limited. This research aims to learn more about the fall characteristics among Malaysian older persons in Klang Valley. Methodology, study design, cross-sectional study. The study is collected at Senior Citizen Club in Klang Valley. It is a purposive sampling methods which include 91 community dwelling older person, male and female. Subject inclusion criteria are age must be 60 years old and above, able to communicate reading and write either in Malay or English, able to follow simple instruction, and able to walk at least 7 meters with minimal supervision. For the exclusion criteria, vision, hearing, and severe speech difficulty, unable to comprehend and follow instruction, unstable heart condition, or in medication that may impact the test result, and ethical consideration by University Kebangsaan Malaysia. Flowchart for data collection. First, participant that meets the inclusion and exclusion criteria will be included, and the consent form will be given to the participant once the participant agreed to participate in the research. And demographic information for characteristic will be taken through interview, and physical test will be performed by a trained physiotherapist. And finally, the data will be analyzed using SPSS. For results and discussion, the pattern of falls among older persons who fell in the previous 12 months, which is make up about 47%, where almost half of the fallers group experienced falls more than once in the past 12 months. And the correlation of falls in this study mainly occur at the outdoor. Common area of falls are stairs, bathroom, hall, and kitchens. Bathroom reported the highest number of falls occurrence. Bathroom reported having the greater risk of having falls injury due to small space with slippery surfaces, hard floors, and metal features. The majority cause of falling was sleeping. The nature of the bathroom tends to be slippery and leads to greater risk of falling. Physical ability after falls can be divided into 3 areas, which are able to stand independently, need help to stand, and the last one is admitted to hospital. In this study, majority able to stand independently of the falls make up about more than 90% of the participants. The condition after falls, which are bruises, scar, bleeding, fractures, or no injury. So majority of the participants having bruises after falls, followed by fractures, scar, bleeding, and no injuries. So falls that lead to bruises similar to previous study in China, and falls that lead to fracture also have been reported in previous study. Analysis using one-way ANOVA indicate that there are three factors that have significant cause of fall risk, which are increasing age, recurrent falls, and using walking aids. When the person aging leads to loss in muscle mass, strength, reduced physical ability, and balance, which lead to higher risk in falling. Same goes with the recurrent falls, where indicate that the person have a poor physical performance, hence higher risk of having recurrent falls. Same goes with person that having or using walking aids for mobility. So this indicates that person have higher risk of future falls due to their lack of balance and need to depend on external devices to walk. In conclusion, this study indicates that increasing age, recurrent falls, and the use of walking aids are significantly associated with fall risk among older persons. The data or the result that we find may help to empower healthcare professionals, caretakers to reduce the risk of injury, hospitalization, loss of independence, and decline in overall well-being of an older person. Additionally, the information provided may guide for future prospective study of falls, especially among older Malaysian persons. Thank you. These are the list of references, and thank you for your time and attention.